I'm Thijs, I'm the VP of the Radiology Research Department. I joined Lunit in July 2020.
My name is Hyunwook Park. I'm a research scientist in the research department of Lunit. I'm part of the oncology department. I joined Lunit in July 2020.
My background is in artificial intelligence, so I studied AI, partly in my hometown and partly in Amsterdam, where I got my master's. And after that I did a PhD in medical imaging at Radboud University in the Netherlands. And after that I worked at a startup in Berlin for 2.5 years where we built a triaging solution for screening mammography.
I carried out a bachelor in physics at Imperial College London. And after this bachelor I decided to move to Switzerland, to the city of Zurich. And there I carried out a master's in computational science and engineering. And after this, I did a doctorate in computer science, specifically in the areas of computer vision and deep learning. And since then, I have now returned to Seoul, Korea, to work with Lunit. At Lunit, we have two main departments, the radiology department and the oncology department. The radiology folks, they focus on the correct detection of cancer, whereas in the oncology part, we try to understand how best to precisely target people who we know have cancer. It's potentially an incorrect statement, but my joining Lunit may have been unlikely in the sense that I had no experience in medicine and so forth. But then I was walking around the KCCV2021 conference. It's the International Conference on Computer Vision, and it was held in Seoul, Korea. And accordingly, Lunit had a gigantic booth at ICCV. Since I had already known about Lunit, I just asked various things, beginning from the algorithms they might be using, all the way to how they might market the product. But I remember that it was an incredibly engaging conversation, and I felt that, wow, okay, if people at this company really understand so much about what they're doing and why, then it sounds like a pretty exciting place to be.
I think Lunit is very strong when it comes to research. We have quite a big research team, I think 20 or 30 people. The algorithms are state-of-the-art at the moment, and also Lunit has some of the biggest databases in the world, which is important for the problems we are working on. The AI team is really strong, and in my opinion it's the strongest AI team from any medical imaging startup.
Lunit is not only producing papers in a very specific subfield or subtask in computer vision and machine learning. Lunit produces medical papers. Lunit carries out clinical trials, and all of these works are done in-house and in collaboration.
The key difference between Lunit and other companies, I think Lunit is very open when it comes to sharing technology and results. Many of the results are published in scientific papers. Also, technical details are published. Then people are open to try the software online. What I really like about Lunit is that all the executives are engineers or medical doctors with a background in engineering, and they really understand the problems we're working on. I think that's very important.
At Lunit, every month we have a general assembly where multiple executives come to us in a Zoom meeting and explain to us what were the major events that have happened in the past month. One of the things that was said by Brandon at a recent general assembly was that Lunit is a global company that is located in Korea. I think that envisioning your company to be a global company in the context of being on a small region of Northeast Asia is a very bold statement.
A few years ago there was a lot of enthusiasm about these algorithms. Geoffrey Hinton famously said that we will replace radiologists 5 or 10 years from now. That's clearly not going to happen. We need to make sure that the products work well in combination with radiologists. The ultimate goal I want to achieve at Lunit is it would be great if the algorithms, the products we build are deployed worldwide.
At Lunit, my hope is to continue or resume my basic research directions in the context of improving Lunit scoped products. Also be able to confidently say that I had a very clear contribution in producing this product, in making sure that it is the best performing product in the world for analyzing pulse light images, such that we can make sure that they get the right treatment at the right time.